Thanks for watching this. I'd like to take a few minutes of your time to introduce Topic, our new Older People's Improvement Collaborative. This is an innovative and exciting approach to improvement in the Trust, funded by our Trust charitable funds. Over the last year, I've been working with colleagues in care of the elderly to develop this, and I'm very pleased that we're launching it today. We all know our population is ageing, and older people who need care and treatment in hospital often have very complex needs and require specialist care. We also know that caring for older people is not always recognised as highly skilled and demanding and very rewarding nursing work. Topic is setting out to change that. The collaborative will involve all staff, but is directed at nurses and healthcare assistants, and particularly at our current and future leaders, and I'm encouraging all staff in the ward areas to get involved. The Older People's Improvement Collaborative will be overseen by a programme board which I will chair. I'll be joined by our non-executive director Lynn Cole, clinical director Nick Majdamar, Sheena Fish, directorate manager, Bob Ollie, an artist and sculptor and ex-miner from South Shields, whose work can be seen in South Tyneside Hospital, Professor Brian Dolan, who many of you will know because of his international work on nurse leadership and end PJ paralysis, Professor Charlotte Clark, who's Executive Dean for Social Sciences and Health at Durham University, but also a nurse with a specialist research interest in the experience of people living with dementia, and Diane Palmer, Deputy Director of Nursing, who will run the programme and chair the steering group. The Older People's Improvement Collaborative, Topic for short, will focus on improving essential patient care, improving patient experience, improving the recruitment and retention of registered nurses and healthcare assistants, and increasing staff development and education opportunities, including quality improvement and leadership skills. I just want to say a few words about each of these. Provision of essential patient care is central to our work as nurses. As part of Topic, we want to reduce harm in several key areas which won't be a surprise to you: falls, pressure ulcers and medication errors. We also want to increase MUST compliance and get our patients up and active, so we are refreshing our approach to PJ paralysis. To improve patient experience, we want to include patients in the Topic collaborative and work with them to understand and then develop a person-centred culture to enhance their care, treatment and experience in our trust. We will also involve their families and carers, as their views are very important to us. To improve staffing levels, we will focus on recruitment and retention of staff, particularly registered nurses who want to care for older people. We want to make our nurses caring for older people feel valued and recognised for the complex care that they deliver, so that they want to stay and develop within older people's nursing at the Trust. To improve access to development and education, we want to ensure our nurses have support to develop throughout their career and maximise their own potential. We want to equip our current and future nurse leaders with expert clinical and leadership skills, and we want to encourage all staff to enrol on our bespoke Older People's Nursing course at Sunderland University, set up in conjunction with this programme. The collaborative will link ward-level improvement projects across our care of the elderly wards, which will be organised under the 4 areas I've just described. And there'll be support for staff throughout, provided by our Quality Improvement Facilitator, Lisa Pinkney, our lead nurse for Quality Improvement, Rob Common, and our Practice Development nurse, Kelly Thurgold. We hope to see very positive outcomes from the collaborative and celebrate the success at the end of the Topic programme, as well as sharing what we've learnt and building in ways to make our progress sustainable. I hope you'll all support Topic and enjoy making a positive difference to caring for our older people. Thanks for listening.